Hi, today we're going to be talking about a CD microfluidic pathogen detection device. My name is Alex Yoon.
My name is Kalmykov.
My name is Daniel Gorelick.
My name is Teodorescu.
And the objective of this device would be for early detection of oncologic central line associated bloodstream infections at a low cost.
The current problem is that during cancer therapy, patients often require central lines for administration of numerous therapeutic modalities, including chemotherapy, other medications, blood products, and nutritional supplementation. Unfortunately, because central lines are going from the periphery to generally the vena cava right next to the heart, there are, out of the 3 million central lines used in the US, they're extremely vulnerable to bacterial infection that go directly to the heart and to the rest of the body. There are at least 250,000 annual cases of central line associated bloodstream infections every single year, resulting in a whopping 99,000 deaths every single year. And from a health economic standpoint, every infection on average costs $16,550. And unfortunately, in cancer patients in particular, when they're very sick, they're very vulnerable to infection, particularly given poor nutritional status. And worsening this is the fact that when they do get sick, there are often no visible signs of infection, such as pus, redness, or pain that would normally alert clinicians to the presence of infections. Therefore, the gold standard right now is when patients appear very ill, they might have a blood culture sent that subsequently takes days to weeks to return, during which time physicians are often faced with the difficult task of deciding whether or not to treat patients in the absence of concrete data. And the implication of that is not only would they have to be receiving fairly powerful antibiotics, but they would often have to get their central line removed, which can be a quite invasive procedure and then subsequently require reinsertion later on. During the time that their central line is out, they cannot receive chemotherapy. There are many other therapeutics they cannot receive, such as potassium supplementation. And furthermore, infections are often only apparent when they're very widespread, and that means that they very often do lead to death or severe complications.
So our solution would be to make a CD microfluidic pathogen detection device. And we would utilize the centrifugal force to drive the samples through this microchannel system that we've made.
This device is comprised of 8 different chambers of identical microfluidic devices, with the first chamber being the sample loading chamber, where the blood sample will actually go in. It will travel down the pathway, as you may see, being joined by fluid from the second chamber. The second chamber will provide a lysis buffer, which would lyse the host cells, which is red blood cells, white blood cells, and whatever else is in the blood, leaving only bacteria, which are more rigid and robust. Then the sample will reach the third chamber, where the primary antibody is coated on the bottom of it. The bacteria will bind to as an antigen, and from the fourth chamber, the secondary antibody will flow in. And the secondary antibody has the fluorescent detection system. When upon shining of the laser, it will fluoresce. Therefore, it will not get bleached or deteriorate over time. And as the sample goes through, the unbound stuff will go into the waste reservoir and collect there. And 8 microfluidic devices will provide for a more rapid detection of a bigger sample.
So the advantages of this device is that we'll have early detection and we'll be able to use smaller samples. On top of that, these devices are relatively cheap to make, and since CD technology is so ubiquitous, we can apply it in any setting, even in outpatient setting.
So next thing, we're going to calculate and optimize the flow dynamics of this device, flow volumes, and all the coefficients of friction. We're going to manufacture the beta device and test it. We're going to adjust all the parameters, and then we plan to apply to FDA for the approval, which will be followed by clinical trials, and hopefully approval around twice.
Thank you so much. We had a great time working for the Center of Future Technologies in Cancer Care Hackathon. It was a great weekend.
Thank you.